Good afternoon. I'm Kathy Lytle from the Mayo Clinic Health System Community Engagement Department. Welcome and thank you for joining the webinar today to learn how drugs and alcohol can impact our youth. Before we start the presentation, I want to run through a few logistics. We encourage you to ask questions anytime during the program. Please use the Q&A icon at the bottom of your screen to submit your questions. You can also upvote a posted question to move that question to the top of the list. A reminder that this webinar is being recorded for future viewing. You will receive a webinar recording along with a brief survey a few days after the event. Now to introduce today's speaker. Dr. Oesterle is co-chair of addiction medicine for Mayo Clinic Rochester. He serves as the medical director at the Mayo Clinic's intensive addiction program and medical director of Mayo Clinic Health System's rural chemical dependency treatment, also known as Fountain Centers. Dr. Oesterle joined the staff at Mayo Clinic in 2014 and holds the academic rank of assistant professor of psychiatry in the Mayo Clinic College of Medicine and Science. Dr. Oesterle earned his BA from Brigham Young University in Provo, Utah, and his MD at the University of Minnesota Medical School in the Twin Cities. He earned his MPH through the University of Minnesota School of Public Health. Dr. Oesterle completed training in adult psychiatry and fellowships in child, adolescent, and addiction psychiatry through the Mayo Clinic School of Graduate Medical Education. Dr. Oesterle is a board-certified adult, child, adolescent, and addiction psychiatrist. Dr. Oesterle's clinical time is focused on the treatment of individuals and complex treatment-resistant substance use disorders in both urban and rural settings. His research focuses on utilizing technology to assist with treatment for substance use and genetics of substance use disorders, and evidence-based treatments for opioid use disorder. He has given many presentations on his work and has authored journal articles, abstracts, and other written publications. Thank you, Dr. Oesterle, for joining us today. So I will let you start presenting.
All right, let's see if I can do this correctly. Okay, does that look okay to everyone?
Full screen, yes, perfect.
Excellent. So excited to be here talking to our community in southern Minnesota, southeast Minnesota, wherever you're at within our Mayo Clinic family. This is a topic that is, well, let's actually go back a slide at least to the introduction. So this is a topic I have the opportunity to speak on a lot, and it's something that is very important to understand for every aspect of care for individuals. This is really a topic that hits home to most individuals. So hopefully it'll have broad interest here today. All right. So let's start with some statistics on how significant substance use is in general. So there's estimated costs associated with substance use. We could probably go into a long talk about all the details of how these costs are calculated, but just know substance use disorders are very expensive to society. And so treatment and finding treatment options for these challenges are obviously very important. So as you can see, a total of $524 billion per year are estimated to be spent on or estimated to be related to the cost of substance use disorders. And this information comes from the National Institute of Health. So I'm going to talk a little bit about our understanding of substance use disorders, obviously focused on our understanding of substance use disorders in adolescence, but this is my first introduction to substance use disorders as an adolescent in the 80s. And this actually represented fairly well our knowledge level at that time related to substance use disorders. We knew it cause problems in the brain, but didn't have a lot of detail on what those problems were. But luckily, we've made significant advancements in the last 40 years since these commercials. I hope some of you recognize this was a commercial that was shown on television that was supposed to emphasize the danger of substance use for adolescents. So this is what it looks like today. This is our understanding of substance use disorders. We understand that addiction itself, or substance use disorders, is a chronic disease characterized by compulsive behavior, continued abuse of drugs despite negative consequences, and persistent changes in the brain's structure and function. So we understand now that it's actually an illness of the brain that starts when an individual is exposed to these substances, but then progresses and develops essentially on its own, sometimes independent of substance use. So how do these chemicals work in the brain? Well, they tap these addictive substances, they tap into the brain's communication system, and they change the way in which the brain normally sends and receives information within that system. So they mimic natural systems, and they fool the systems in the brain into being overactive. So the same with a lot of other illnesses. We talk about COVID-19 a lot. COVID-19 is a virus that comes in and uses some of our own natural systems to replicate itself, reproduce and cause more havoc. So that's the same way in which these substances come in. They use some of the natural mechanisms that are already there in the brain to cause trouble. So on to the next. So most substances of abuse are related or affect in some way the dopamine system in the brain. So this is a system that helps us regulate emotions and understand things or develop cognitive processes related to things. It also has to do with pleasure and emotion. So dopamine is a very important molecule used by the brain in a lot of different ways. And the primary way in which these substances of abuse affect the dopamine system is to overactivate that system in particular areas of the brain. So this is a really general representation of the relative dopamine levels in specific areas of the brain associated with different things. Oh, it used to slowly progress through this, but looks like it just jumps out. So that's fine. But what you can see there is food activates this dopamine system, this reward system in the brain, which is good. We should receive some reward and some incentives associated with food that encourages us to continue to seek out food and utilize food because food is essential for our survival. Cocaine uses the same system. And as you can see, it ramps up that system. And so there's a specific amount of dopamine release associated with smoking and snorting. And you can see that smoking is actually more dopamine release than snorting. And that's related to the speed in which that is absorbed in the body. So now on to adolescence. So we understand that substance use disorders really is a disease of development. Most individuals that we see as adults with substance use disorders started their exposure at an early age. So this is the relative exposure of the three most common substances of abuse in the United States. So marijuana, THC, alcohol, and tobacco. So just to give you an example of where the majority of the dependence-related behaviors started to occur. So you can see, especially with marijuana and alcohol, it's in the teens to 20s that individuals usually start developing these symptoms. You can see tobacco tends to have some spikes a little later in life, and that story is a bit more complex, but it fits this trend relatively well. So what do we know about adolescents that makes them uniquely susceptible to substance use disorders? Well, we know that their brains are growing and developing. We know that development occurs all the way through the mid-20s. And we know it's a development of from the back part of the brain to the front. So the front part of the brain is the last part of the brain to develop. And so what does that mean? It means that things like judgment and restraint are some of the last things to develop. Again, really looking at the 20s, early 20s for that area of the brain to be fully developed. The early things to develop are motor coordination. So young people tend to be much more coordinated well before they are showing a lot of restraint. And there's also early development in the emotional centers and the motivational centers of the brain. So what does that mean for us as we work with or as we try to parent adolescents? Well, they're going to have difficulties controlling emotions. There's a preference there among this group for high excitement and low effort activities. They're going to have poor planning and judgment, not really able to see several steps down the road, more risky and impulsive behaviors. So because of those unique attributes of adolescence, we know that there are some unique aspects then of their substance use disorder or their development of addiction. So adolescents are much more likely to become addicted to marijuana than alcohol, as opposed to adults. So this is in comparison to adults. But they're much more likely to binge drink in comparison to adults. They're also more likely to report hiding their use. It's often illegal for them to use, so that makes sense. But they're also more likely to endorse that they use despite fights and despite trouble. And they're blinded to their own behavior patterns, are more likely to be blinded to their own behavior patterns. And in most of the time, adolescents that enter treatment are referred there through the juvenile justice system. So really long down the road when things have gotten really bad for them. And a lot of this has to do with the environment in which they live. They're really supportive. They're not adults where they have to get up and go to work every day. Somebody's caring for them. And so they're sheltered a bit from some of the consequences that can happen more early on in significant substance use. The adolescents are actually less likely to seek treatment, less likely to report withdrawal, again, as opposed to adults. They're less likely to have these significant consequences, as I mentioned. Their insight and incentive and their motivation for treatment is directly correlated to how effective treatment is, and it's more prominent in adolescents than it is in adults. Although they're less likely to be motivated for treatment, motivation for treatment is a greater predictor of success in treatment. So we spend a lot of time in treatment with adolescents trying to help them develop motivation. Okay, so we're going to step back here a little bit and talk about trends related to substance use disorders in adolescents. So these are, again, the three most common substances of abuse in adolescents: alcohol, marijuana, and cigarettes. These are the relative rates of 12th graders' use in the last month. And this is a good kind of overall metric for understanding relative use of substance use disorders in general for adolescents. So what do we know about these trends? Well, we know there's been a downward trend in alcohol, a downward trend in cigarettes, and there's been a bit of an upward trend. So you can kind of see that from this chart. So let's point out some of the things that we know may be associated with these trends, and we'll talk about why this is important here in a minute. You can see a bit of a dip in the 90s, starting in the early 90s and late 90s. You can see alcohol use in adolescents declining. And it was an interesting time in the 90s. There was a lot of these advertisements that started coming out about the dangers of adolescent alcohol use. And we think that they had a significant impact. They actually were quite graphic, and we'll show some of these here in a minute. And they were also targeted to youth in TV programming that they frequented. So like MTV, for example, which was quite popular back then. And I think is still today, I'm not sure. And cigarettes, again, they started declining as well. Around the same time, a little bit more of a delay. And that was the time of the tobacco settlement. And again, a lot of these advertisements that started talking about the dangers associated with tobacco use. So we saw kind of an opposite trend in marijuana around the same time. There was a lot of medical cannabis legislation, and then a lot of kind of opposite sort of messages that were going on in media campaigns around the country. And we saw kind of a shift in the overall perspective related to marijuana. So these are the current rates of substance use. So you can see alcohol has even declined. So this is 2020 data. So this is an updated statistic. So alcohol use has even declined even more since 2014. Cigarettes, interestingly enough, has had a bit of a shift. So cigarettes themselves, so these are normal nicotine cigarettes, so combustion cigarettes, they've actually declined even more. So they're less than 10%. But what you see is 24%, that's actually vaping of nicotine. So vaping of nicotine is really taken over and actually overcome marijuana as being the dominant, sort of second most common substance of abuse. So the marijuana rates have really largely kind of stuck about the same. Again, that has to do with the perception associated with its risk really kind of staying about the same. And we'll talk about that here in just a second. So this is tobacco. These are some of the ways in which we talk about tobacco with our adolescents. We try to make it relatable. This is all the chemicals. Pardon me, I said marijuana. This is tobacco. So this is all the chemicals in the average cigarette. This is what we're trying, this is kind of the image that we're trying to speak against, right? So that we're trying to kind of counteract is this perception that, there's this, it's cool, it's adult, it's, the famous people that I look up to are doing it. So it's this type of perception and the billions of dollars in advertising associated with this type of perception that's out there. So this is information from the tobacco trials. This was widely talked about several years ago. This was really acknowledgement. So this was emails and internal correspondence that came out of some of the large tobacco companies talking about the need for them to really target young people if they're going to be successful as a business. And, while that, clearly makes sense from a business standpoint, the fact that it's such a highly addictive substance, and adolescents are uniquely predisposed to developing an addiction to it, really caused some concern related to these memos. So this group of this company, the base of our business is the high school student. Philip Morris, today's teenager, is tomorrow's potential regular customer. Because of our high share of the market among the youngest smokers, Philip Morris will suffer more than other companies from the decline in the number of teenage smokers. So it's a common strategy to get folks when they're young. Again, they become sort of lifelong customers because that's where the development of addiction really starts, as we talked about. So there's this idea, or there used to be this idea when there was a push to put some restrictions on nicotine, that there was nothing wrong with nicotine or smoking, that it was actually good for you, right? So there was a lot of advertisements citing studies and clinical reports and these types of research studies, that cigarettes were really a positive thing, and that anybody going against cigarettes was going against health or going against what was best. They would have doctors talking about why Camel were their favorite cigarette, and so this was kind of the mixed message that the public were receiving when the medical community first started voicing some concerns about nicotine. And again, a lot of the consequences associated with smoking we're kind of seeing more down the road. So it was difficult to see some of the more immediate effects of smoking a cigarette. And so it was a little easier to kind of hide. I thought this was particularly troublesome. Asthma cigarettes, not recommended for children under 6. So at least they had some sort of guidelines associated with it, but just so you know, cigarettes are not recommended at all for asthma. So please avoid them in general, but especially if you have asthma. These are some of the messages that kind of shifted that, right? So this was kind of that counter message that talked about the consequences associated with smoking, and they appear to have sunk in. So there was a general sort of consensus out there, at least among young people, that they were more risky than they once thought, and that led to a decrease in use. So these are some statistics from the Surgeon General's report. It's the most widely used drug in the United States. It's also associated with the largest preventable causes of disease and mortality. You know, you can see 3,000 teen smokers begin smoking, and 1/3 of them will become daily smokers each day. 90% of adult smokers began as teenagers, and so that's a really important one. So if you can get folks when they're young, get them to stop smoking when they're young, they're much more likely to not smoke as adults. They're particularly sensitive to nicotine. We'll talk about that in just a second. Some of the studies have shown that. So let's look at that. So this study is in rats, but also been replicated in some ways with adolescents. So if you expose an adolescent rat to nicotine, they're much more likely to become addicted as an adult rat to nicotine. And again, this correlates well, but this was one of the first studies to show that. Shifting gears here a bit to alcohol. Again, this is the most common substance of abuse in adolescents. This is the kind of message. So the estimated ad spend would be about $6 billion by 2023. You know, it's close to that already. This is the type of advertising. I don't think any of you have been immune to this advertising. This is what we see everywhere. And this is, again, what adolescents are seeing. This is this idea that alcohol is medicine. Again, as there was this push to put some restrictions on alcohol and how it could or should be used, there was a pushback, right? That no, alcohol is medicine. And for a long time, when we didn't have a lot of good medicines, alcohol was what was often used to treat all sorts of ailments, right? So this one is particularly interesting, how mother and baby picked up, you know, in quotes, a case of Blatt's beer in your home means much to the young mother, and obviously baby participates in its benefits. The malt in the beer supplies nourishing qualities that are essential at this time, and the hops acts as an appetizing, stimulating tonic. So we all know today that this is exactly the opposite of what's true, right? You know, alcohol should be kept as far away from an expectant mother and a mother, and especially a baby. So not consistent with what we currently know. But again, it was this idea that, hey, this is a medicine. Why would you take this medicine away from people? This was interesting, for it contains the great building and health producing properties the system demands. That is why the most successful doctors prescribe malt nutrient. So again, this was a prescribed sort of a prescription sort of approach for alcohol. This is that counter message, right? The risk, helping folks understand, especially our adolescents, understand the risks associated with it. And again, as we talked about, it was associated or has been associated with a decrease in use, which was great to see. So this is some sort of literature on the harm associated with alcohol, but also some things to understand. If you can wait till an adolescent is 21 before they start drinking, their chance of becoming an alcoholic decreases significantly. And that's the rationale for that age. So there's binge drinking problems. There's been a stabilization in the perception associated with binge drinking, where it was the perception of risk associated with binge drinking had been going up significantly, which had led to a decrease in that. But there's been some stabilizations. It seems at this point we've convinced, at least statistically, the amount that we're going to convince with our current approach. So underage drinking causes more than 4,300 deaths a year. You know, you can see the emergency room visits linked. So binge drinking is by far the most common and by far the most dangerous way to consume alcohol. So this is interesting. I always bring this up because we think sending kids off to college, right, is a good thing, and it is, but we've got to remember that their problematic alcohol use will go up when they enter college. It won't go down. So if they were having struggles in high school with problematic alcohol use, the likelihood of that getting worse is, when they go to college is pretty high. So this is the effects of alcohol on the developing brain, something we know a lot about, something that's been really well established. There's issues with processing speed, attention, and tasks, and all these types of things in folks that used alcohol at a young age, and that was associated with the amount of drinks that they were using. Shifting gears to marijuana here quickly, and I've taken probably a little bit too much time on the first part of my talk, so I'll try to move through this relatively quickly. As most of us know, the advertising for marijuana has increased significantly, so there's a lot more ads. The majority of these ads are actually on internet displays. We're not seeing a lot of these ads in newspapers, but the dollar amount associated with ads in newspapers really is linked to the states in which there's legalization for marijuana, where we know adolescents consume the most content related to marijuana is online. So they're more associated with this $370 million. This was in 2019. This is projected to go into the billions as we progress. Again, this is a developing area of commerce, especially for a lot of states that have really relaxed their restrictions on marijuana. So this is that concept that's out there. These are online sort of things. It's cool, you know, this concept that it's cool to smoke marijuana. So marijuana is used by successful people. This is Jennifer Aniston saying, "I enjoy smoking cannabis. I see no harm in it." Marijuana didn't ruin his career or his life. This is again another famous actor, you know, just advocating that it's harmless. And then this idea that marijuana is medicine, and the idea that it's being rather than going through traditional medical means, you know, there is THC and cannabidiol that's available as prescription that, you know, physicians can do as prescriptions for certain illnesses that have been FDA approved, or certain conditions, I should say. But the idea that states are going around that normal process of the research and development that kind of goes into that, and certifying it through non-medical means, more legislation, is kind of where we're at right now with the marijuana as medicine. And I think everybody here today knows that and knows the current state there. Again, the perception of risk is the key for substance use disorders. This is particular to marijuana. There was, in the 70s, there was high perceived risk. And so there was low, there was opposite of what I just said. There was low perceived risk. So there was high past year use, right? And that perceived risk increased. There was a lot of advertising campaigns back then talking about the dangers associated with it. And so the perceived risk went up, and use went down, and we saw that kind of flip. We talked about that in the 90s, and things have kind of stabilized a bit now. This is again that kind of ability to kind of, how do we, you know, these companies are thinking obviously about customers, right? How do we get customers? Well, we make it fun, we make it appetizing. You know, making it candy in candy stores. And these are just some pictures from Colorado. Is it addictive? Yes, it is. You know, just pointing out here, adolescent addiction rates for cannabis are about the same. What often gets cited is the cannabis addiction rates in adults, again, which is less than alcohol, but for teens, it's the same. So it is an addictive substance. We know that from animal studies. Animals can get addicted to it. And the more THC, the more addictive it is. And let me run through that really quickly. So the relative concentration of THC has increased significantly. In the 90s, it was around 3%. In the 70s, when all those advertisements about how scary it was when those were going on, it was around 1% THC content. Now it's much higher. And so, there's just something to think about there. Marijuana legalization, and that increased the relative percentage significantly in Colorado. The THC concentration, now it's up around 35-40%, probably higher than that. And that has to do with the amount of research that could get put into making more concentrated strains. And then now we have the vapes that are essentially 100% THC, right? Which are consumed through the vaporizers. This is just the level of evidence that we know. This is a few years old, this evidence. This has just been further supported. This is again from the National Institute on Drug Addiction data of the harm associated with marijuana. These are more resources if you're interested in this idea of how media can impact substance use in teens and adolescents. These are the behavioral approaches that we utilize in treatment. I'll run through this really quickly. Important to note that they're all group settings, or most of these have been researched in group settings, which has made delivery of treatment really difficult through COVID-19. We've been doing it and doing that virtually for most of our folks. This is just a study about the availability. Availability went down, but substance use stayed about the same. So even though the availability was down, adolescents continued to use about the same amount during the pandemic. I'd like to keep moving here. And this is just a statement from the NIDA director about the fact that just restricting substance use for adolescents isn't enough. Again, we need to shift the perception related to them and convince them that there is some risk associated with it and to be careful. And that's been our approach with other substances. Looks to have worked to some extent. Obviously, it hasn't eradicated it. But just putting restrictions in place to access isn't sufficient enough. So that's what I had. I moved through some of those slides, especially the last few slides, relatively quickly. So I would love to hear questions about anything that we've talked about, or just anything that's not contained within these slides as well.
Dr. Oesterle, we do have a couple of questions in our Q&A. The first one is, where does alcohol use fall on the dopamine continuum?
So we talked about the relative dopamine exposure. So it would be so that slide where we showed cocaine and dopamine release, it would fall just under cocaine. But I also want to emphasize that it's relative exposure. So the more exposure you get, the more reinforcing it becomes. So even if it has a relatively low spike in dopamine, if you use it excessively and consistently, you can train your brain to seek out that, or adjust your brain to seek out that substance.
Thank you. Another question, does cigarettes include vaping? And I think that's when you were on that screen showing the alcohol and
yes,
usage, so.
Exactly. So the original sort of graph did not include vaping. It just wasn't really that prominent during 2010 to 2015, which was on that graph. The last numbers I showed, though, did include vaping, and you can see that actually nicotine has had a resurgence in the adolescent population because of vaping. And now adolescents are consuming more nicotine via vaping than they are marijuana, where for a time they were consuming on average more marijuana than they were cigarettes. Does that make sense? Is that clear? Okay.
All right, another question. What are some behaviors to look for in the teens in my house if I suspect substance abuse?
So great question. So there's obviously some more direct things that if you smell alcohol on their breath, or they're coming home acting strange, those are really obvious signs, and things that could be addressed on the spot. Change in behavior, change in personality, change in friends, any dramatic change for an adolescent. There's often slow progression of things, but a big shift means something's up, right? And often it's related to substance use. So just look for that. They're more defensive than they've ever been. They're more, they've changed who they're hanging out with, and it's worth the radar should signal that that's something to look into further.
Okay, thank you. And next question, at what age does the brain fully develop?
So we think in most folks it's around the mid-20s, so about 24, 25, and everybody's a little different. But that's the what we know today as being the most common age for the full development.
Okay, next is, how familiar are you with fetal alcohol syndrome? I have adopted a son from South Korea with FAS and am looking for information. Does FAS affect dopamine in a child when in the womb?
Oh, that's a great question. I don't know about the dopamine response of the child in the womb, that in particular, but obviously fetal alcohol syndrome is related to exposure to alcohol while a child is developing, in the womb, in utero. So that development is sort of hijacked by the exposure to the chemical, to alcohol. It's a spectrum. So what we know is that fetal alcohol syndrome and fetal alcohol disorder, there's a spectrum there of symptoms associated with that. And there's often a host of different challenges that can kind of come along with that spectrum. And it really kind of depends on where folks sit within that spectrum. Individuals can have really mild symptoms, and individuals can have really pronounced symptoms. And I just would encourage somebody to connect with their pediatrician and get a full evaluation, and they could kind of talk through what degree of effect an individual has, and help you develop a plan.
We've got all kinds of great questions coming in. You said vaping was a higher percent than people smoking marijuana. Is that because people are vaping THC instead?
That's a great question. I didn't put the THC vaping in there, but the vaping of THC is actually lower than the combustible marijuana consumption right now. Our guess is that it will increase, and that it will likely take over. I'll just call it combustible marijuana, or the smoking of marijuana. So, but right now THC consumption is lower, and the vaping that I cited was just nicotine. So it was just these nicotine vaping. And just to show that the consumption of nicotine really hasn't decreased down to 7%, it's really gone up, because now folks have just switched the way in which they're consuming nicotine. And it's a huge change, right? There was restrictions as to how much nicotine an individual could consume with a vape or with a cigarette. There's no restrictions associated with the vaping, which is a huge challenge, and we're still learning what that means.
What evidence-based practices have you seen work best to reduce substance abuse like alcohol and vape?
So a lot of good approaches. We've seen community-based approaches work really well, in which they focus on the home and the home environment, and reestablishing healthy relationships with family and healthy friends. Adolescents are influenced significantly by the environment, even more than adults. Adults are as well, but adolescents are particularly impacted by their environment. So having a community approach is helpful, and their community is their families often, and then close friends. And if you can get that community on board and moving in a healthy direction, that's really helpful for adolescents. We often use cognitive behavioral therapy, which is really clear and easy to understand for most adolescents. But there's a lot of different therapy types, and a lot of them work really well. And I went through them really briefly at the end, but each one of those listed have a lot of evidence associated with them. I know I'm running out of time, Kathy. Keep going. I'll try to get to as many of those as I can.
For a couple more.
Okay.
So, yeah.
We'll keep plugging away.
Our next question is, how do you perceive the legal availability of Delta 8 will impact adolescent substance use, misuse, and dependence?
Oh, that's a great question. I think it's perception of risk, right? If our adolescents feel that THC is really a low risk substance, it's not going to cause them any issues. That's really what causes a lot of their use. If they see it as high risk or high harm, they're going to decrease their use. And so the readily available or the fact that it's so readily available, I think, is a problem. Because they can just experiment with it, and they'll see more people experimenting with it. My guess, and I would just have to guess at this point, is that it will increase, but I guess we don't know that yet. So still learning. We'll gather that data.
Does alcohol and drug use in utero make addiction more likely later in life? Yeah,
so that's a great question. So exposure, prenatal exposure to substance use, we do know that does can predict later issues with substance use. And there's factors that can mitigate that and help with that, and the stability in the environment does play a role. But yeah, those individuals are more set up for various reasons. But
this is a great question. What are some talking points to relay to teens about the consequences of substance abuse?
There's great talking points from the National Institute of Health, NIDA, NIDA. I cited a lot of their resources today, and they have a lot of resources about that specific question, because there's a lot of good ways, but you want to be factual. The adolescents know how to use the internet. They're very savvy with it, and so they will look up things and they will challenge things. So you want to be factual, and you just want to give them the facts. Look, we know achievement goes down significantly if adolescents are using. You just not, this idea that they can't reach their full potential because on average their achievement on a lot of different areas drop. The studies that are in there that are cited are really factual, really good studies, really well done studies that have been vetted and well approved by experts. And so start there, stick to the facts. There's enough facts to support asking adolescents not to use these substances.
And this kind of runs into that too. It says, any advice on confronting youth without driving them away?
Be neutral in your tone, be calm, try not to be combative, emphasize the concern, emphasize that, the love that you feel for this individual or the concern that you have for this individual, but keep neutral. So they'll be defensive, and then that's natural, expect that. But just continue to say the concerns that you have, say, I feel this way, I've seen this, just use these I statements to say, look, these are the concerns that I have. This is why I'm concerned for you. These are the facts that I know, again, as we talked about that, and that's why I'm concerned.
Thank you, Dr. Oesterle. Unfortunately, we're running out of time here, so we're going to have to stop the Q&A. So I would just like to thank Dr. Oesterle for his presentation today and extend a thank you to all of you for joining us for this webinar. I'm just going to remind you a brief survey, and the recording of today's webinar will be sent to you soon. We ask you to take a moment to complete. Your input helps us plan for future programming. Also, we encourage you to share the recorded session with your family, friends, and colleagues. So again, thank you everybody for joining us today, and make it a good day.